So today, our presenter is Mary Claire Akers. She is a licensed social work and the executive director of Allen County Drug and Alcohol Consortium. She has a master's of social work with a concentration in leadership from IU School of Social Work. She strives to seek relevant and effective interventions to serve her community in reducing barriers to healthy and successful lives, with a belief that it starts with taking care of and transforming skills to those choosing to serve. She is the executive director of DAC, which is Allen County, which is the second largest. She corrected me the other day, and I'm like, I should know that.
I can't believe
I know. They are the second largest LCC in our community and our metropolitan area. Correct, Mary Claire?
Yes.
Yes. DAC is a hub of activity with more than 130 partner agencies working within their area, and they help to meet their mission. Mary Claire works purposefully to have DAC be a safe, accessible, inviting, supporting, and loving space for collaboration, innovation, and planning. So welcome, Mary Claire. We'll turn it over to you.
All right, sounds good. So hi, everybody. I don't know how many of you I have met before, but for those of you that I have met before, welcome and thank you for coming today. For those of you I haven't met, if you are not familiar with me, I'm very open to calls, questions. If you want to interrupt me and ask something or clarify something, please do. We have a pretty relaxed environment up here at the Allen County Drug and Alcohol Consortium. So I'm assuming most people on the call are from other LCCs, right, Kimbra?
Yes. Yeah, okay. LCCs and DFCs in Indiana.
Okay, perfect, awesome. And sometimes I come on the DFC calls if Monique is out, but Monique is our DFC person up here, so she usually does all that stuff. But if you ever, have a question, Monique can usually answer it for me too. But if you want to call me directly, that's always fine. Our office number is on the screen. You can switch out the coordinator for Mary Claire at DACAC.org if you want to get directly a hold of me, or you can always email coordinator if you have a quick question you need answered, because in all actuality, that coordinator goes to most of us, so we will answer it much more quickly if you need something fast. So that's the real deal. Okay. So just so you know, I talk a lot about trauma in this presentation. I know we're talking today and kind of focusing what we're discussing on any of the programs that we do with youth in Allen County. Trauma is ingrained in everything that we do. We try to find a trauma focus and to look beyond essentially what we're dealing with in the moment and look at the bigger picture. As social workers, if those of you that are social workers out there are trained social workers, then you know that we meet people where they are, and that involves embracing everything that they brought in their experience to the table so that we can talk to them in their truest form and be in our truest form with them. So a lot of what I talk about in the beginning part of this presentation is trauma. So if you need to take a break, take a drink, walk away for a minute, please do, because it is hard for us, even as regular caregivers of youth, to wrap our head around kind of what kids deal with on a day-to-day basis in our communities. So just that little disclaimer there. So why do we do trauma-informed care? Why is that at the center of everything that we do with youth? Really, we look at the different areas that can be considered childhood trauma. If you have not heard of the ACEs study, it's the Adverse Childhood Experiences Survey. There is a wealth of information that you can get about that. What it measures essentially is the stressful events that youth encounter before the age of 18, and how that then impacts the rest of their lives. So there's way more than depression, substance use, poor grades. There are so many things that go beyond, our younger years and our mental health that actually can translate right into physical health issues as well. So the ACEs is the survey really brought to light that when we are dealing with trauma, we are dealing with the whole person and not just the mental health aspect and not just the safety aspect of people, but the higher the ACEs score, the more likely you are to die younger and all kinds of things. So we'll talk about that. But up on the screen here, so we went to why trauma informed care, and then what is childhood trauma. So these three columns that you see here on the screen, those are kind of just a loose categorization of the different types of trauma that can be experienced and that were measured on the ACEs. There was a limited number that they put in to the study results, but they took into consideration hundreds of different potential traumas and how those formed the mind, body, health, and everything of the person that experienced the trauma. So if you kind of look here at this, you're seeing that 60% of children have been exposed to violence, crime, or abuse. And then 1 in 15 children are exposed to domestic violence every year. Okay. And then it's very common for kids that experience one trauma to experience multiple traumas. So there's different types of trauma. We don't need to go into the specific details about that, but there are single traumas where, you were in a bad car accident and now you're, terrified of being in cars, that are driving on the highway or something. There are traumas such as witnessing a parent being abused physically, being abused yourself, those kinds of traumas. And then there's complex trauma, which is trauma that kind of compacts on top of other traumas throughout your childhood that just makes it a little bit more difficult to deal with trauma going forward. So our goal in serving children and working with what we can do to minimize the trauma is to flip that and I'm going to try and make it so it hides these pictures. It's driving me crazy. There we go. Okay. Is we can flip that by giving protective factors to those youth. So you can see on this slide here, there is the normal and the abused brain. And the brain on the right, that doesn't mean that this cannot come back. This is not brain that is gone. Okay. This is brain that is not activated. So the trauma has caused the brain to not be active in these areas that are missing a lot from what the normal brain has of the same age person. So that doesn't mean that this can't be brought back. And how we bring that back is by building safety and protective factors for our kiddos. So the trauma, it disrupts the development of the brain, but it does not stop the development of the brain. So brains can still continue to develop over time. And we want to make sure that nobody thinks anybody that has had a lot of trauma is a lost cause, so to speak. Really, when we're working with youth and adults that have experienced trauma, what we want to do is we want to build back up those safe and positive neural pathways for them to have a more quote unquote normal experience in life. So there's just a lot that goes on. So and this is just an example for anybody that knows what a record player is on this call. A needle on a record player, complex trauma wears that groove in the brain. So when we talk about building those pathways, we want to be reminded that trauma can cause our bodies to replay traumatic experiences and to continue to seek the same coping mechanisms, such as alcohol, drugs, restraining your eating, that kind of thing. Anything that people do as a result of that trauma. And then it also, when we're always in that fight or flight mode, people come to a place where their amygdala grows and the rest of their brain essentially has issues, has trouble, taking up space and being able to develop new skills. So we have to calm the amygdala and essentially regroove where we want the brain to go when something happens, and not to go right into fight, flight, or freeze mode. So trauma in kids is linked very directly to health and social problems in the ACEs study and every study essentially they've done since then. So we always see the Maslow's hierarchy of needs. This is essentially the opposite of what we're seeing for that. So the general embodiment of trauma, historical trauma, social conditions, adverse childhood experiences, that disrupted neural development we were just talking about, social, emotional, cognitive impairment can occur. We can then develop those risk behaviors such as drinking, using alcohol, using substances. Some people do, they cut or they restrict their eating, all kinds of different things. So those are kind of on top of the disease, disability, and social problems that come from that. And then one thing that we know is that for anyone that has 4 trauma categories or more, their life expectancy actually decreases by 20 years. So that doesn't mean that they don't make it those 20 extra years, but the likelihood of that is much higher for people that have 4 trauma areas before the age of 18. So we want to, when we're working with kids and we're working in the community and in the schools with kids, we want to make sure that we are building protective factors that can counteract all of those, not just the risk behaviors, but the risk factors that are associated with those traumas. So I'm going to show you, because it's just so much easier to go to our website than to put everything into a PowerPoint. There's a section of our website and it looks, this is the center of it, this picture here on the right. We want to make sure that we are always doing things in a manner that is looking at the evidence to determine what action we're going to take. So I call this slide the Indiana Youth Survey because I want you to know that anytime you go onto the website and you click on this Indiana Youth Survey, you're going to get right to the website that gives the most recent data. If you've done the INYS survey in your county, you have a little bit more specified data for your county, but on the website itself, if you haven't done it, you can get numbers that are based on your region. So they do a more regional number that way. So that's in this link that I'm going to go to, but I want to show you this link. And this is the DAC website. It's a very simple website, dacac.org. And when you look at all the programs that we're working on, these middle 2 columns are the ones that I kind of screenshotted there. And these are all programs that we can do within the schools and that we are doing within the community. So to kind of talk about how you get into the school system is a little bit, it's a little difficult in certain areas because there are so many levels of administration within the school systems. So what it really takes is finding an advocate that is close to this element of the work. So Indiana has the legislation that says every school has to have a social emotional learning specialist in their school. And we know that there are some places where the social emotional learning specialist is also, the attendance person, but the attendance person also knows a heck of a lot more about those kids than we know as an outsider from the outside of the school. So if getting in touch with the social emotional learning coordinator is something that you can do, if you can offer trainings to those social emotional learning coordinators across your county or maybe a multi-county area, that's a good way to get in because they have a lot of metrics that they have to meet within the school systems to make sure that the kids are on the track for social emotional learning. So even our most disparate school systems are usually, and I mean that not in that they have maybe the major health disparities, but I mean in that their funding is low and they don't maybe have the extra grants that come to big school systems like Fort Wayne Community Schools, which has the most students in the state. So if you look at who you can get in with, those are a good bet. And then also most schools have some kind of a safety committee, and maybe that's the school resource officers, maybe it's, the administrators that come together, twice a year or 4 times a year to talk about school safety and how they can prevent school safety concerns, some negative safety aspects. So if you can get in with the school safety officers, that is where you're really going to kind of get to the top of the chain. So social emotional learning specialists or coaches, however they call it in your school system, and then the school resource officers or the safety team. So how DAC got in, which is just a little different, is that we started talking about the Indiana Youth Survey. So we looked at the Indiana Youth Survey and what our participation rate was at DAC. And it was, some years it was great, some years it wasn't. And we kind of looked to see what that meant. So why is that the case? When we looked at, this is just the Allen County information. When we look at the Allen County numbers, as far as how many people actually participated in it for the, I think 2017 maybe 2016 year. It was dismal, you know, and then there was a great year. I think it was 2018 because they switched from odd years to even years for our DMHA grants. And you could see the numbers were really evident of issues and what those issues were. So some of the things that are covered, if you're not familiar, are these things that I think are pretty important here, just right here in your table of contents. The prevalence of rates for alcohol, tobacco, and other drug use, the age of first use of alcohol, tobacco, and other drugs, the community risk and protective factors that were identified, and then some other pieces that just break down that information a little further. So we took this information to the school safety officers and to the social emotional learning coaches and said, this is what's happening in our county, or if you don't have county data, but you have regional data, this is what's happening in our region. These are the areas of concern. This is why this is a safety issue for your school. If you have students that are actively using drugs, alcohol, involved in gangs is another question that I have on the survey, that they are have high frequency of self-harming behaviors, that there's a low perception of harm for using alcohol and other drugs, or if there's a high perception of peer use of those things, then the school ultimately is less safe because of that. And then the school is not able to do what they're there to do, which is to educate, to provide the tools for youth to become educated and to understand concepts and all that. So taking the data that's real and true and putting it in front of education providers is really one of the things that makes it an undeniable thing that they need to address. And it helps them to understand why this is not just a, hey, that's the counselor's job, or, you know, that's the family's responsibility. It's something that you can relate directly to how the school is going to be impacted, or how it's already being impacted by what we see in this survey here. So the survey is a little difficult if you haven't looked at it before, but there's so much information in there. No matter how many people take it, it breaks down every piece of information that you have. So it is not hard to make this a relatable, cause for each school within your system. So that aspect of what we do to engage the school systems through that Indiana Youth Survey is one way, works especially well, again, with the safety committee. Now, if we're talking about the social emotional learning coaches, when we're looking at them, we want to give them the data that impacts how they are going to perceive. Again, hold on, I'm going to scroll down a little bit so you can see what I'm talking about. What is going to, some actual tangible tools that they can have that they can use with the populations that they're serving to automatically kind of up their game and their ability to put kids in a space where they can learn, as opposed to putting kids in detention, or, you know, in some kind of a suspension, or separating kids out into various classes where they're not going to work, you know, because the environment isn't conducive to that. But helping the teachers and the staff at the school understand and recognize why adverse childhood experiences are impacting their work and their ability to teach those students. So we want them to realize the impact of the experiences on neurobiological development. We want them to recognize the impact trauma has on learning and the behavior, and we want to respond by building resilience and avoiding that re-traumatization in the schoolroom. So I'm going to pop back over to the website to show you, because all of these resources are on here, and I want you to be able to dig deeper into them when you see them later. If you look at where's my one? Oh, it's not on this page. It's on the home page. Sorry, this is a weird one because it's brand new. So one of the things that has really got us in the door with the schools here is what we, is anybody doing handle with care within your communities that's on the call? Okay, it sounds like no, but I know that there are some communities across Indiana that are doing handle with care. So I want to show you a little bit about Handle with Care, you can see how it works and how that can engage the school systems to open up and work with you. So essentially, the goal of Handle with Care is not to put any more work on the teachers and the staff at the school, but to find a way to alleviate some of the pressures that they're already experiencing as a result of all these youth having so many traumas within their lives. So outside of school and inside of school, but mostly outside of school. So some ways that we talk to the different, the police officers in our town, the student resource or the school resource officers. We talked with the social emotional learning coaches. We talked with the safety, the people that do all the safety oversight, which is usually an internal person that then manages the police officers that come in for school resource. But we ask that when there is some kind of an event at the home that involves police, that we bring in, we bring a notification to school the next day so that they understand very vaguely what's going on in that school system or in that child's home life, that there might have been something traumatic for them and they can kind of look into a different way to approach the child that day. So we understand that teachers are overwhelmed. We understand that school staff and administrators are overwhelmed, police are overwhelmed, our systems are already overwhelmed. But if we can show them how some simple, changes in their response to children that have been in a traumatic situation the prior night, how just a simple change in their response to the child can change the tune of that whole week for the child, but also for the whole classroom. So if you're constantly having to pull a kid out of class because they're having behavioral issues that they're not talking about because they don't want to be in trouble with at home, or they don't think anybody knows, or they are just having a physiological reaction to the trauma that they've experienced, that's disruptive to your classroom. And anybody that works in the school system is well aware that you don't get to just leave them out of your classroom all week. They're coming back as soon as they're calmed down. If they went to the nurse's station, if they're in suspension, it doesn't go on forever. As soon as they come back, it could be an issue again. Children that have experienced trauma that are, they act out with their, aggressive behaviors. Of course, that impacts the other students in the workplace as well. So there's an awesome PowerPoint slide that's right on the website too that you can look through. It's a very much longer, long version of what I'm showing you here in this PowerPoint, but also on the website. But essentially what Handle with Care does is when police respond to a scene where there's a child present, essentially, they just put a code into their police system. They have to do a report anyway. Every single encounter is a report. As long as they open that flip pad, then they're going to put a code, they're going to be able to put it into a system so they can find it later into their police tracking system. So we ask them if there's a child present that is school age, that they enter in special attention code HWC, which is Handle with Care. So they have to put the student's first and last name and the student's date of birth. From that point forward, the information is pulled by the morning officer and it is given to DAC, and then DAC, which is us, obviously, figures out what school that kid is in. And then we send a Handle with Care card to the school social emotional learning coach, and that social emotional learning coach will then give that to the appropriate people within their system. What it does is helps the staff provide understanding, observation, support. They do a little survey at the end of the day. How did you have to do anything with the kid? Did you just make sure that they were okay, and if there wasn't anything out of the ordinary, then kind of assume it was all right? Did you provide additional support? Did you not need to? Do you feel like that kiddo needs a referral to counseling? There's that little survey tells us, first of all, where the high needs are within the school systems that we can feed back to the school systems about what kids are needing a little bit more counseling as a result. And also helps the school identify a need for those services when they are looking for their staffing. Good Lord, I'm sorry. They're staffing for the next year. So this is just a Handle with Care flow sheet that we have. We have actually contracted with a local counseling provider to do virtual or on-site counseling, depending on what the child is in need of. But there are all different kinds of things that could be done very simply on the school level to help that kiddo not have as rough of a day as maybe they were going to. So an example might be, and this can be a traumatic experience for a child, and it could not be a traumatic experience for a child, but say grandma has a lot of health issues and they live with grandma, and because grandma, had some kind of an episode related to her health and had to be taken to the hospital, kiddo or husband or whoever calls 911 for grandma, the police respond to that. They know that there's a kid there. The kid either stays with grandpa, or if grandpa goes to the hospital, or whoever else is in the household. And the child has to transfer out of the house for the night, or if the Department of Child Services has to come if there's nobody available. What happens is that code gets put into the system, and that kid not sleeping at their own house, maybe not having their book bag, maybe not, wearing the appropriate clothing the next day. The school is getting a notification that the child had a potentially traumatic event the night before. So if the kid comes in flip-flops and they're not allowed to wear flip-flops to school, and that they're a handle with care case that day, they're not going to be sent home, and they're not going to be made to wear whatever got off of Crocs or clodhoppers they've got there for kids that wear flip-flops. I don't know how it works, but that's how I imagine it would work. But they're not going to punish that kid because they know something happened the night before that was out of their control. And obviously whatever's going on this morning is probably out of their control. The other thing might be the kid comes into school and they're exhausted, and they were up half the night. They were sitting at DCS office until 2 a.m, until finally there was a family member that got off work that could come pick them up, that got the notice that they needed to be picked up. And they're sleeping in class. They're not getting in trouble for sleeping in class. They're asked if they want to go to the nurse and lay down to get kind of a feel for where they are mentally, and the nurse can kind of just do a check-in with them. We send kids to the nurse, for different things all the time. A traumatic experience is certainly something that should be treated like it is a health or mental health issue as well. The other thing, maybe the book bag got left at home. They had to go to another family member's house. They had a test today. They're in high school. This test is a big deal. It's a reason that teacher could take a breath, when they know that kid's not prepared, and they can see that kid's freaking out and say, I'm going to give you an extra day to study and get ready for this, or we can stay after and you can do it when you're not so anxious, or whatever the case may be. So it gives other options that really do not wildly impact the rest of the classroom or the time that it takes for the teacher to do those things. And it puts that light on addressing the children that come into the school that have had a trauma, whether they consider it to be a trauma or not, or that have had an experience that could be traumatic. That gives them a chance to recoup for a day instead of reaping more, punishments or, different, attitudes or sick days. And sometimes it's helpful for us. We can foresee that if a kid doesn't show up to school the next day after a traumatic experience, and they don't get called in, and we know they're handled with care kid, there's a possibility they're with someone that can't get them to school. They're not at their house to get on the bus stop, that kind of thing. So it helps kind of with the whole school system having an idea, if the system is that attendance needs to be called, if a kiddo is going to be absent from school and the kid's absent because they're with their auntie or their grandma that doesn't speak really good English, so they don't understand how to call, or they're nervous to call, they're not going to send out, the truancy police, and they're not going to they're going to help locate the child, make sure the child is safe, but they're going to know that something occurred the night before that is out of that kid's control, out of those parents' control, and that the school can have just a little bit more leniency on those processes with them. So,
Mary Claire, we're running short on time.
Okay, we're close to done. Okay. I want to show you just a couple more things, if that's okay. How many more minutes do I have?
You've got 1 minute.
Okay, I got it. Okay.
What exactly are you guys doing within the schools? I know
so we're doing the Handle with Care program, and then I just want to show you this other program that we do at the schools, and it's called Project Alert.
Okay.
And that is a free program that SAMHSA developed And we have our our school resource officers. I always call them student resource officers, but we have our school resource officers implement that project alert programming, helps build the relationship between the students and the officers, helps them have someone to talk to, talks about all different kinds of experiences the kids might run into. It gives them, you know, information on how to deal with stressful situations, how to get out of a dangerous situation, you know, what to do to keep themselves kind of on the straight and narrow if they are around, you know, gives them ideas on how to get out of poor peer situations and that kind of thing. The other thing that we do in the schools, but is not as broad by any stretch of the imagination, Project Alert is in almost all of our 7th grade classrooms in Fort Wayne Community Schools, which is about 850 students. But ALS Pals is another program that we do. And if you go to the website, go to the dacac.org, you can click on any of those and get more information about ALS Pals. And it takes you right to the strategies and where to go and what to look for. So I highly recommend to get a kind of deeper dive into the things that we are doing in the schools. Our annual report is also on the website. I think it's under news and updates. Yeah, so you can just click right in there and it tells you everything that we're doing in the schools. So it's very, very well done because we had a fabulous graphic designer do it for us this year. But just there's a lot of information about how we reach out now and who we reach out to. I took 2 minutes instead of 1, but does anybody have any questions right now? Do you want to hop back in and do another one later? Like, tell me what you're thinking.
If I could ask a quick question, Kimbra,
Absolutely.
if that's okay. So at the start, you gave some great context on the ACEs and then tied that into the school's social emotional requirement. But what happens when you still meet the wall with your administrators? How have you overcome that?
So
maybe we can stop sharing so we get your full.
Sure, yeah. There we go. Did that work? Did you get my full face now?
Yeah.
Essentially, there's so many different avenues to get in. So if you're not getting in through the social emotional learning person, find the person that's in charge of safety. If the person in charge of safety is kind of giving you the wall as well, find a teacher that you know really cares. Find somebody within your network at your DFC or at your LCC has kiddos in that school system, right? Like somebody out there has kiddos in the school system. We couldn't get into East Allen County schools for the longest time. They still kind of try to reject everything we do. But we found somebody that was on one of our committees that has kids that go, and she happened to serve like on some committee for student wellness at East Allen County Schools. And that gave her a direct line to the superintendent. And she said, you really got to let Dak get in front of you and talk about this stuff because they're helping you and it doesn't cost anything. And that's the way to get in. So we always recommend that if you burned like the night oil trying to get to somebody, you're not getting to anyone. Find a parent that will talk and get that parent to reach out to the administrator. Get that parent to reach out first to, even the social emotional learning coach. And if that's not going anywhere, talk to the attendance person, because the attendance people see so much more of what's going on with families than most of the people that the school is facing. So, or that are public facing. So when somebody calls in their child, I know when I'm calling my kid in sick or calling him in late because I overslept or something dumb like that, which happens. Anyway, I'm like literally just telling that person like, oh, this happened and I stayed up late last night and all these things, they know everything about me. Like, and when I call, I think my name comes up anyway, but they're like, hi, Mary Claire, like they know who I am, because you talk to the attendance person because you want them not to be mad at you if your kid's late, right? Or that your kid's not going to be there. You forgot to tell them about a dentist appointment or whatever. So the attendance people are also a great way to get in. If you know the nurse that is the nurse for the school, if they have a school nurse. We have some of our school resource officers are actually firefighters. So if you know somebody in the fire department and you can talk to the fire department or the police department, if you know the officer of the school, and talk to them about how they can benefit from this building of relationships, that's that's the way to do it. You don't necessarily always go to the administrator because they're really busy and they're going to say, well, I don't have time for you anyway. I got enough programs. I know what we're doing. We don't have any trauma here. We don't actually drink here. Nothing's going on, right? That's usually the case when we go to certain school systems. So getting into them, getting the stats in front of them is really one of the best ways that you can get it out there and get it started. Does that make sense? I mean, is that something has anybody used that before where you're like, oh, I'm going to get this mom that's real loud and she's going to talk to them and I might not get through that first time, but if she talks to them again, or if there's an incident, you know, say a child's brother dies by suicide and that child is having a traumatic experience, whatever. And then the mom comes back and says, remember what I told you about that program the Drug and Alcohol Consortium was doing that kind of helps with kids when they've experienced a grief and loss situation, you know, big grief and loss situation. We probably should look into that. You know, it's like using the experience of the parents, knowing what's going on in the schools is one of the best bets.
All right.
All right.
All right. Thank you very much.
Of course.
And we're now going to move on to see if, I think it's Sadia or
Sadia's on. I love Sadia. How are you? Oh, it's Corey. Hi, Corey. Just kidding.
You sounded really disappointed.
I love you too, Corey. Sadia's my girl, you know.
I know. So that's okay. Well, I'll just give quick updates because I know we're going to be short on time here. So really, we've actually been doing a lot here. I know it may not seem like it from your end, but we're about to produce a whole bunch of things that I think you all will find very, very entertaining. Anyways. All right, so CCP approvals, other than 2 counties, all the CCPs have been approved and the approval letters have been sent out to the LCCs and auditors. So if you were approved, there's one last step that you need to do, which is basically you need to provide an electronic signature to the grant agreement in IntelliGrants. We provided an email last week with instructions on how to do this. So keep an eye out for that and please complete that and let us know as soon as you get that done. We'll send another reminder out here probably tomorrow in case if you forgot. So those are important to get done to have that signature on there because if you do not have that signature, you will not be able to provide us with quarterly reports. Not being able to provide us with quarterly reports then sends us down that long road of saying, hey, you're not doing what you're supposed to be doing. We need to figure out what the problem is and then address that. And worst case scenario, have to place an administrative hold. But we don't like doing that. We don't want to do that. So please provide us with that signature. So speaking of quarterly reports, the first quarterly report will be due on July 15th. All right, and that will be done in IntelliGrants. Also, change we're doing. Instead of sending us meeting minutes directly, just upload your meeting minutes whenever you provide those quarterly reports. That way you don't have to worry about sending off random emails throughout the quarter. We'll provide that out. We'll provide that updated information whenever we do our manual review, and which I'm about to get to. So basically, in the next week, ICJI, we will be doing our annual review of the LCC policies and procedures manual. Any policy or procedure, any changes that we make, you'll be notified on that. There's not going to be any substantial changes. There'll be just minor ones like what I just said, providing your meeting minutes in the quarterly report submission. Also, LCC virtual visits. So our division is going to start scheduling with LCCs our virtual meetings. That way we can have a one-on-one time with each LCC throughout the year. Really, we're going to discuss the CCP, strengths and weaknesses of that, the end of year report, and basically how to improve any sort of documentation and any other technical assistance needs that you may have. Also, we just sent out our LCC newsletter, our very first one. Hopefully it's been sent out. We're told by our communications director that would be published today. So keep an eye out for that in your emails. In that, it provides any updates that we have, tips on how to improve specific sections of the CCP, important submission dates, and any other trainings or opportunities that are available that we know of. So, oh, perfect. Somebody received it. Awesome. Thank you. So the next one will go out in September. So for some, if any of you feel that you have any training opportunities you'd like us to know about and be able to send out to all the LCCs in our newsletter, please let us know. I would be happy to include that if it fits within the scope of the County Drug Free Community Fund. So also data collection. We've been working with our research division team to gather data that was collected from the CCP and our annual survey. We actually presented some information to the Commission to Combat Drug Abuse, and we'll work with the Indiana Coalition Network to schedule a time where we can actually present to you all about the findings that we have. So some of this information includes a comparison between the 2020 and the 2021 CCP, which, for an example, here's just a little tidbit. So in 2021, across the state, LCCs reported that there was a 15.3% decrease in the amount of deposited fees. However, because of COVID-19, a lot of programs were unable to use the funds that they had and had to return them, or just, programs were unable to move forward as what they had planned. So not as much money actually was granted out. Therefore, we saw a 14% increase in the amount of rollover from unused funds from the previous year. So overall, the total funds available across the state for all LCCs, it dropped from 5.6 million in 2020 to 5.3 million in 2021. So that was about a 5% decrease. Anyways, we got charts and graphs and all kinds of good information that we could share with you on those findings. So, all right, that was it. Sorry, I went probably a little bit overboard, but I tried to motor mouth it to get through it all. If you have any questions, contact Sadia and I, okay?
Thank you very much, Corey. And yes, I did receive my newsletter today also, so pretty excited about getting that. Feel free to stay on if people want to network and everything. There are some things on the ICN website that you might want to look at. There is a state ECHO grant that is available and other things that you can. So check out that website. And see if there's some information that might be useful for you. Secondly, if you are not onboarded, please reach out to us so we can get all your information onboarded and accurate on our website. But this will conclude the meeting overall. Thank you for joining us.